I'd like to remind all of you out there this evening that if any of you are experiencing symptoms that may be worsening, please consult your healthcare professional, as each one of these MPNs may affect each of you very differently. So can we talk a little bit, I know that you were referring to 6 on a scale of 1 to 10 maybe. Can we talk a little bit about the MPN10 symptoms and why it's important for patients to know them? What symptoms are involved in the MPN10? Let's talk a little bit about that.
Yeah, I mean, the MPN10 to me as a nurse practitioner is just a simple review of systems. So when you're a healthcare provider, you go in and talk with the patient, you get what we call a review of symptoms. How are you feeling? You know, activity level. Are you more active, less active? Are you doing the activities of daily living? We'll refer to them. You, on a pruritus, would be on a MPN10 scale. How is that itching? Or have you developed itching? Or if it's a new patient, do you have itching? If so, how miserable is it?
Right.
Or is it mild? Is it just with the shower? Have you found ways to limit it? Fatigue is the universal symptom that we hear about from MPN patients. Fatigue is a very common symptom with MPN and in some cases quite profound. Achiness, bone pain is a symptom. And then symptoms related to the spleen are a real hallmark of some MPNs, very much so myelofibrosis. Splenomegaly is quite common in myelofibrosis and to some degree in the other MPNs that we're talking about tonight, ET and PV. Some degree of splenomegaly can be present. And the spleen is an important organ in our left upper quadrant, very much involved in our immunology and our blood. And in this myeloproliferative state, people can have an engorged spleen. The spleen can get large, and the technical term for that is splenomegaly. And that can cause abdominal discomfort, aches and pains. As it's getting bigger, it can cause early satiety, or you fill up really easily when you eat, and that can lead to some weight loss. So spleen-related symptoms are a key part of the MPN10 assessment.